Hello, and welcome to your final acceleration education module. I'd like to take the next 15 minutes or so to summarize what we've learned over the past 9 weeks. So you had this complicated pregnancy and/or delivery. So what does that mean for your future health? You're now at an increased risk for a variety of cardiovascular events and at a much earlier age. There is good news. There is actually a lot that we can do to help decrease this risk. The numbers I presented on the last slide talk about future risk after these various pregnancy events. But what is really important to know is that these are the risks if we do nothing about it. The great news is that there are plenty of risk factors that we can modify through changes in our lifestyle behaviors. Approximately 80% of risk factors are modifiable. Four of these modifiable behaviors include physical activity and exercise, nutrition, sleep quantity and quality, and mental health. So let's start with physical activity and exercise. Among many other benefits, physical activity reduces postpartum depression, anxiety, and stress. It can help with self-confidence, and when paired with healthy eating, can contribute to weight management. And finally, of particular importance to each of you who experienced a complicated pregnancy, being physically active decreases the risk of future cardiovascular diseases and type 2 diabetes. How much physical activity is recommended? The Canadian Physical Activity Guidelines recommend that we as adults should get a minimum of 150 minutes of moderate intensity activity each week, which when broken down equates to approximately 30 minutes per day, 5 days a week. When it comes time to introduce resistance training to the mix, it's important to do it gradually. One way of doing this is to start with body weight exercises and then progress to resistance bands, then dumbbells, and finally barbells. Okay, so next we'll focus on nutrition. So why is nutrition so important? Well, what you eat and drink is important for your health and to help you care for your baby. It's no secret that the foods we eat fuel our daily activities. And this is especially important when those daily activities include caring for your little newborn and possibly breastfeeding or pumping. You may feel too tired and overwhelmed to think about eating healthy while taking care of your newborn. Eating healthy will help your body to recover and feel better, and not just recover from the delivery of your child, but also the daily grind of caring for your child, lack of sleep, maybe breastfeeding, the whole gamut of taking care of your baby. You are not eating for two at this point. However, your body needs to restore a lot of important nutrients. In the months after childbirth, most new moms require somewhere between 1,800 and 2,500 calories each day. If you're nursing, you'll likely need up to 500 more calories per day than if you were not nursing. If you're underweight, you work out more than 45 minutes a day, or you're feeding multiple children, that number could be even higher. Fueling your body with the right amount of calories will help keep your energy and your milk supply up. Individual calorie needs are highly variable and depend upon a number of factors, including body size, age, activity level, and how much you're breastfeeding. Okay, what about nutrition, specifically for mothers who are breastfeeding and pumping? We want to consume predominantly whole foods. Lots of fruits and vegetables, whole grains, good quality proteins such as eggs, chicken, fish, seafood, nuts and seeds, organic tofu, full fat dairy. Whole sources of carbohydrates like fruits, whole grains, and starchy vegetables. And then we want to pair that carb source with filling protein-rich foods like eggs, chicken, beans, nuts, and seeds. We want to consume healthy fats to help with that feeling of fullness, but we also want to focus on portion sizes that promote health and prevent added weight gain. You want to include healthy protein sources at each meal. Include vegetables in at least 2 meals a day. You should start your day with fiber in conjunction with protein for the perfect combo of energy and sustenance. Plus, fiber can help with any sort of constipation that may be lingering in this postpartum period. We want to eat foods that are rich in nutrients like vitamin C, zinc, and selenium to help keep your immune system strong. What are some of the things that we might want to avoid while breastfeeding? As much as possible, we should avoid alcohol, or at least in large quantities. We want to be mindful of our caffeine intake. So the CDC recommends sticking to about 300 milligrams or less each day. And we want to just be mindful of our fish intake and ensure that it's low in mercury. High mercury fish includes swordfish, shark, king mackerel, tilefish, and tuna can have some mercury, so we want to eat the light kind and really no more than 6 ounces of tuna each week. All right, so let's talk about sleep next, both sleep quantity and quality. Good sleep is necessary for good health. Experts say we need somewhere between 7 to 9 hours of good quality sleep each night to stay in good health. Not getting enough sleep can stress the body in many different ways. Over time, poor sleep can cause major cardiovascular disease risk factors, including obesity, high blood pressure, and diabetes. It can change the hormones that control our eating behavior, possibly causing us to gain weight. Increased tiredness can lead to us making unhealthy lifestyle choices. It makes us less able to cope well with the normal challenges of life, leading us to make poor health decisions. Sleep deprivation and some different sleep disorders have also been linked to increased inflammation in your body, which can increase your risk of cardiovascular issues also. Poor sleep and sleep disorders can cause depression, anxiety, and stress, and other mental health issues, which also lead to increased cardiovascular concerns. Okay, so we often hear this term sleep hygiene being thrown around. So what does it really mean? Sleep hygiene refers to both your sleep environment and behavior. Healthy habits, behaviors, and environmental factors can be adjusted to help you have a good night's sleep. Poor sleep hygiene can negatively impact both your sleep quantity and sleep quality. Good sleep hygiene includes things like setting up a strict sleep schedule, following a bedtime routine, forming healthy habits, and optimizing your bedroom for sleep. Paying attention to sleep hygiene is one of the most straightforward ways that you can set yourself up for better sleep. Strong sleep hygiene means having both a bedroom environment and daily routines that promote consistent, uninterrupted sleep. Every sleeper can tailor their sleep hygiene practices to suit their specific needs. In the process, you can harness positive habits to make it easier to sleep soundly throughout the night and wake up feeling well rested. Sleep hygiene alone will not cure sleep problems, but it can set you up for the best outcomes possible. So talk to your doctor if you have any concerns beyond these sleep hygiene tips. And finally, let's talk about mental health. Okay, let's focus on postpartum depression for a couple of minutes. Around 1 in 7 women can develop postpartum depression. It is not a character flaw or a weakness. Sometimes it's simply a complication of giving birth. If you have postpartum depression, prompt treatment can help you manage your symptoms and to help you better bond with your baby. Alarmingly, as many as half of postpartum depression in new mothers goes undiagnosed. And this is usually because of conflicts in privacy and shame, mothers not wanting to disclose to close family members. Sadly, there's a stigma around new mothers in that disclosure may lead to abandonment or a fear of lack of support. Interestingly, studies show that new fathers can also experience postpartum depression. They may feel sad, tired, overwhelmed, anxious, or have changes in their usual eating and sleeping patterns. These are the same symptoms that many mothers with postpartum depression experience. Fathers who are young, have a history of depression, experience relationship problems, or are struggling financially are most at risk of postpartum depression. Okay, let's shift a little and talk about postpartum anxiety. I came home on day 3 or 4, and the moment I walked into the house, I burst into tears. The feeling I wasn't going to be able to cope with this. Does that sound familiar? This is one of those that most of us feel like we've experienced at some point or another. 1 in 5 women has experienced postpartum anxiety. Okay, we're now going to shift to talk about post-traumatic stress disorder. About 1 or 2 in every 100 women have post-traumatic stress disorder after giving birth. Post-traumatic stress disorder, also known as PTSD, is an anxiety disorder caused by very stressful, scary, or distressing events. PTSD can develop immediately following an event, weeks later, or even years later, often triggered by something. Some women can experience PTSD after pregnancy and delivery. This often stems from things like bad or traumatic birth processes, pregnancy loss, or many other things. This could lead to a fear of future pregnancies and childbirth. If you feel like you might be struggling with postpartum depression, postpartum anxiety, or post-traumatic stress disorder, please consider reaching out to one or all of the following resources: your family doctor, the 24/7 mental health crisis line, and you can see the number on the screen there. You can call 1-800-944-4773, which is the Postpartum Support International line, or reach out to a friend or family member to talk. One of the best ways to nurture and help protect your mental health, especially during this postpartum period, is to engage in self-care. Self-care means taking the time to do things that help you live well and improve both your physical health and mental health. Self-care can be whatever you want or need it to be. All right, what's so important about self-care? Having an effective self-care routine has been shown to have a number of important health benefits. Specifically, self-care has been shown to have a positive impact on stress, anxiety, and depression, improve resilience and happiness, increase energy, and reduce burnout. Research suggests that proper self-care can strengthen our relationships, family relationships, romantic relationships, our friendships, relationships with our children. Self-care has also been shown to lower the risk of illness. Proper self-care may end up leading to eating a more balanced diet, exercising, getting more sleep, and these can help improve cardiovascular health, reducing the risk of chronic diseases like diabetes, and boosting our immune systems. When we take care of our bodies, we're investing in a better quality of life, both now and in the future. All right, I hope over the past 9 weeks, you have learned that although you are at an increased risk of cardiovascular disease, and much earlier than those who have not had a complicated pregnancy or delivery, that there's still plenty you can do to decrease that risk. Physical activity, nutrition, sleep, and mental health are all modifiable risk factors. I hope the education we have provided you over the past 9 weeks has helped you initiate or continue healthy behaviors to help decrease this risk of future cardiovascular disease. I've uploaded a variety of resources related to all of these topics in the Health Library of the Acceleration app. You can see this pictured here on the screen. I encourage you to take a few minutes to look through these resources. Thank you.